Welcome. Today, we're diving into Williams syndrome, a rare genetic disorder that often presents with distinct cardiovascular challenges. We'll explore the underlying causes, how it affects the heart, and the ways we can manage this condition. Williams syndrome arises from a microdeletion of genetic material on chromosome 7. This deletion typically involves the elastin gene ELN, as well as several other neighboring genes. Elastin is crucial for providing elasticity to blood vessel walls and other tissues throughout the body. This missing genetic material is usually a random event during the formation of sperm or egg cells, meaning it is rarely inherited from parents. The absence of the elastin gene significantly impacts the cardiovascular system. Without sufficient elastin, blood vessels, particularly the aorta and pulmonary arteries, become stiff and narrowed. This narrowing, known as stenosis, forces the heart to work harder to pump blood. Over time, this can lead to high blood pressure, thickening of the heart muscle, and ultimately heart failure. The specific type and severity of heart problems vary among individuals with Williams syndrome, depending on the extent of the genetic deletion and other individual factors. Williams syndrome is estimated to affect between 1 in 10,000 to 1 in 20,000 live births worldwide. It affects both males and females equally, and occurs across all ethnic and racial backgrounds. Because it is a genetic condition stemming from a random event, there are no known environmental or lifestyle factors that contribute to its occurrence. Individuals with Williams syndrome often exhibit a constellation of signs and symptoms beyond just heart-related issues. Common cardiovascular symptoms include heart murmurs, shortness of breath, fatigue, and chest pain, especially during exertion. Other distinguishing features often include developmental delays, learning difficulties, a characteristic elfin facial appearance, and an unusually outgoing and friendly personality. They may also have hypercalcemia or elevated calcium levels in the blood, especially in infancy, as well as feeding difficulties, gastrointestinal problems, and musculoskeletal issues. It's important to note that not every individual will exhibit all of these symptoms, and the severity can vary greatly. Diagnosis of Williams syndrome usually involves a combination of clinical evaluation and genetic testing. A doctor may suspect Williams syndrome based on the individual's physical characteristics, developmental history, and the presence of a heart murmur or other cardiovascular abnormalities. The diagnosis is confirmed through genetic testing, specifically fluorescence in situ hybridization, or FISH, or chromosomal microarray analysis, CMA, which can detect the deletion on chromosome 7. While we don't classify Williams syndrome into distinct types, the severity and specific manifestations of the condition, particularly regarding heart involvement, can vary considerably. Some individuals may have mild stenosis requiring minimal intervention, while others may experience more severe, life-threatening cardiovascular complications requiring multiple surgeries or procedures. Management of Williams syndrome is multifaceted and tailored to the individual's specific needs. For cardiovascular issues, treatment may include medications to manage high blood pressure and heart failure, such as beta blockers, AC inhibitors, and diuretics. Surgical interventions, such as angioplasty or open heart surgery, may be necessary to repair narrowed blood vessels. Ongoing monitoring by a cardiologist is essential. Beyond cardiovascular care, other interventions may include physical therapy, speech therapy, occupational therapy, and educational support to address developmental and learning challenges. Dietary modifications may be needed to manage hypercalcemia and feeding difficulties. Because Williams syndrome is caused by a random genetic mutation, there's currently no way to prevent it from occurring. However, genetic counseling is recommended for families who have a child with Williams syndrome. This allows them to understand the risk of recurrence in future pregnancies, although the risk remains very low. Prenatal testing, such as amniocentesis or chorionic villus sampling, can be performed to detect the condition during pregnancy if there is a known family history. The prognosis for individuals with Williams syndrome varies widely depending on the severity of their condition and the effectiveness of treatment. Early diagnosis and comprehensive management, especially of cardiovascular problems, can significantly improve outcomes and life expectancy. Recent research focuses on understanding the molecular mechanisms underlying the genetic deletion and its effects on various organ systems. This research aims to develop more targeted therapies to address specific aspects of Williams syndrome, potentially improving the quality of life for those affected. Advances in surgical techniques and cardiac care have also improved the outlook for individuals with significant heart involvement. Continued research and support for individuals with Williams syndrome are crucial for maximizing their potential and ensuring a brighter future.